Long, long time ago when I was just a little girl, I really wanted to help people, and it just kept growing and growing, and suddenly I was a doctor taking care of patients, doing what I had dreamed of since I was really little. The toughest part of my job as a physician is when patients are at the end of their life, and really your treatment has to switch over to a more palliative, more comfort type treatment. It's very difficult for some physicians to have this end-of-life conversation with patients and with their families. Celtic and the Journey program are here to help them have that difficult conversation. The Journey program actually takes away some of the burden of the conversation for doctors. It makes it a little bit easier for doctors to go about their day-to-day business. I begin to think about the Journey program at Celtic when a patient is starting to resist active treatment, or the active treatment is no longer going to be beneficial to their life, whether it's improving their quality of life or extending their life. We expect that Journey program would help to decrease the cost of care for a patient. There's less running back and forth to the emergency department, less urgent care, and more involvement with nurses, home health people, and the physician in the home as opposed to in the hospital. If you're thinking that a patient is no longer wanting very aggressive care and they're about maybe a year out from passing away, that's the time to get Journey in there. A family and a patient who benefits from the Journey program is going to have a little bit more of a comfortable acceptance of the end of life, and it's tailored towards the patient's needs and desires at the end of their journey. It helps for doctors to recognize that it's not lack of care, it's just a different level of care. You know it works when at the end of life, the patient and the patient's family thanks you.